You can't undo a stroke, you can't undo a heart attack, but here's what most people don't realize. The risks that lead to them don't appear the day of the event. They build for 20, 30 years, silently while you're feeling fine. And the healthcare is not paying attention for that. And what stops that is not another generic screening or another pill. It is a different kind of a relationship with a physician who actually knows you and stays current with the evidence and catches drifts before they become damage. And that's exactly what I built my practice for. And in this video, I'll show you why it matters more than most people realize and what continuous prevention actually looks like. In the next few minutes, I'll walk you through why standard primary care misses what matters the most, the two opposite ways your doctor can fail you, a clinical pattern I see that shows the real cost of waiting, and what continuous physician-led prevention actually look like when it's done right. I'm SAFA SHIARI, board-certified physician in internal medicine and obesity medicine, and I spent years taking care of patients in their 70s, 80s, and 90s. And that's where I learned the most expensive thing in medicine isn't a hospitalization, it is losing the ability to live independently. And that experience is the reason why I built this practice the way I did. Let me start with what actually is going wrong. Most people don't see the doctor when they're feeling fine, and they only see them when they're feeling off. It seems reasonable, but that's the wrong model to prevent the things that kill most people. The risks that end in a heart attack or stroke don't start the day of that event. They start decades ahead, silently. By the time you have symptoms that are severe enough to land you in an ER, they've already been permanent cell death, heart muscle dying, brain tissue dying. And some people recover fully, but many don't. And they're left with heart failure, weakness, cognitive dysfunction that they cannot undo. And then they finally get serious about a doctor. But at that time, it's not for prevention, it is more of damage control. And you're on multiple medications for the rest of your life because now the risk of having another event is much higher and you cannot take back time. So why doesn't standard care catch this? Two reasons, and they're opposite. The first one, your doctor is warm but isn't rigorous. They listen, they're kind, you leave your appointment feeling heard, but they don't stay current with the evidence. They don't want to rock the boat. They refill what you have started years ago without ever asking if that's still the right choice for you. NICE doesn't catch a medication that's harming you in the long term, and NICE does not prevent a stroke. The second, your doctor is brilliant, but they cannot connect. They know the evidence cold, but they're seeing 30 patients and they don't have the time to get to know you or understand your life or your goals. So they hand you a regimen that's technically perfect, but is completely impractical for your situation. Even great doctors become cookie cutters at that volume, not because they don't know better, but because the system won't let them slow down. What you actually need is becoming very rare. You need someone with the depth to know what's happening in your body and the time to make it personal. Let me show you a pattern I see all the time. Picture a woman in her 60s on a blood pressure medication called atenolol. She's been on it for many, many years, and she's feeling fine. Her labs look okay. She sees doctors, specialists, and no one touched it because they don't want to rock the boat. But the evidence has changed. We don't start people on atenolol anymore because it has a lot of side effects. It can cause fatigue, weight gain, cognitive issues, diabetes risk, and many more. And we have better options now that have less side effects and can prevent multiple things at once. A good doctor will explain all of this. But a lot of people would say, I've been on this for 20 years, I'm feeling fine, I don't want to change it. And that's their goal, as long as they understand the risk. And the trouble is what comes next. A health event, a hospitalization, and instead of changing one medication at a time gradually and carefully to allow your body to adapt, they change everything at once. Because a crisis mode does not allow thoughtfulness. And they need to get you out of the hospital as soon as possible, and people end up feeling awful for weeks, if not months. And what I hear afterwards is some version of this. I wish I had made that change before all of this happened. And that's the cost of nice but not rigorous, and care that manages symptoms instead of prevention of complications. On the other hand, I get many patients on atenolol, and usually it's an awkward conversation because it will be our first or second visit together. They don't know me well, but I take the time to go over this medication when we review everything and explain the same thing to them. And I'll have many who would opt to make that change, and we make it gradually over weeks. And if they don't feel well, we make it even slower. But they are going about their life the normal way. Nothing changes. There's no hospital stay. There's no weeks or months of recovery. And that's a huge difference. But here's the alternative. A physician who's looking at your cardiovascular risk over decades, not just whether your numbers fall within range today or this year or even like 5 years from now. Who order tests that actually predicts what your heart function is, what your blood vessel situation is based on your own risk factors, not just a basic cholesterol and a one-time EKG. Who watches your trends over the years, and if there's a drift, we catch it before it becomes a permanent damage. Same physician every visit, with real time. Real time to listen, real time to think, real time to explain why we would make a change if we need to. I stay current with the evidence, and every time I'll be reviewing your medications to make sure, do we still need it? Is there something out there that is better or has less side effects? I deprescribe as much as I prescribe medications. And that's what I mean by continuous prevention. It's not constant visits, but it's also not panic-driven reactive management. It's a real relationship with a physician who has the depth and the time to make your care personal. Problems are caught before they become irreversible, and changes are made on your timeline and not in an emergency department. The ultimate goal is to protect your ability to actually enjoy the years you've worked hard towards. You cannot take back time, but you can invest in preventing the moments where time stops to matter. So if you're looking for a physician who thinks this way, who has both the depth and the time to actually get to know you, that's what this practice is built for. Book a comprehensive evaluation or book a discovery call to see if this is the right fit for you, or you can also join our wait list. Link in description.